Good afternoon, dear colleagues. Today we will talk about artificial or bottle feeding. Bottle or artificial feeding is a type of feeding when child during the first 6 months of life receives only formula or formula and breast milk, but the amount of breast milk is not more than 20% or fifth part of daily volume of food. Of course, the best type of feeding for babies is breast milk. However, in some situations, breastfeeding is not possible. The cause can be both diseases of mother and baby. At this slide, you can see indications for bottle feeding from the mother side and from the child one. Indications by the mother are divided into absolute and relative. Absolute mother's indications for bottle feeding are agalaxia or severe hypogalaxia, malignant tumors, severe blood diseases, psychiatric disorders, AIDS, purulent mastitis, and mother's death. Relative indicators depend on the specific situation. They are severe infectious diseases, severe decompensated diseases, or severe endocrine diseases. The indications for bottle feeding by the child are as follows. Severe allergic reactions to breast milk protein or enzymopathy, lack of enzymes required for carbohydrates metabolism. In ancient time, milk of animals like cows, goats, camels was used for artificial feeding. Now this is done only in poor countries. Animal milk is just as different from breast milk as a newborn baby is from a goat or a calf. Nowadays, children are fed artificial formulas, which are close in composition to breast milk. Why are they artificial? Preservatives, flavoring, flavor enhancers, etc. are prohibited for their production. In composition, they are analogues of breast milk, but artificially created. The source for creating artificial baby formula is cow's or goat's milk or soy. Milk for preparation of artificial formulas must be on the highest quality and meet certain requirements. This milk is called formula composition milk. So, formula composition milk is cow's milk with follows characteristics. Lipids amount no less than 35 grams per liter. Carbohydrates not less than 40-45 grams per liter. Acidity not more than 20 degrees by Turner. Dry sediment not less than 85 grams per liter. Absence of pathogenic bacteria. General number of bacteria not more than 50,000 per milliliter. Escherichia coli is 1 for 10. So this milk can be used for milk formulas preparation. Artificial feeding has its own rules that must be known and strictly followed for the safety of the baby. At first, formula must be on hand at all times. If formula runs out, parents should buy a new pack in advance. Parents shouldn't change formulas often. Advice on choosing or changing the formula should be given by a doctor. Ideal conditions for storage of open dry mix: a dark dry place with an air temperature of 14 to 42 degrees Celsius, not longer than 3 weeks. It is not necessary to store the open dry mixture in the refrigerator. It doesn't extend its shelf life. Bottles and nipples must be sterilized. Any formula that baby has not milked should be poured. When the baby touched the nipple, his saliva entered the mixture, the formula, and it's from this moment in the bottle with food begins the active process of bacterial reproduction. Therefore, you cannot store this formula. You can use it for up to an hour or dispose of immediately. Diluted formula can be stored not longer than 3 hours at room temperature, 14 to 24 degrees Celsius, before feeding the baby, and in the refrigerator for no longer than 24 hours. You have to remember that artificial formulas may produce more gas and constipation. Formula-fed babies may have more gas and firmer bowel movements than breastfeeded babies. Significant disadvantages of formulas is their price. Artificial formulas are much more expensive compared to breast milk, which is free. Artificial formulas don't contain antibodies, so don't provide immunity to the child, and can't match the complexity of breast milk. Thus, artificial feeding has a number of disadvantages compared with breastfeeding. However, in some situations, this is the only way to save a child's life. At this slide, you can see classification of artificial formulas. All formulas divided into two big groups, nutritional and therapeutical. Nutritional formulas are unadapted and adapted. Nutritive unadapted formulas are sweet and sour. Sour formula is kefir. Sweet formulas are number 1, 2, 3, 4, which means diluted cow's milk with different proportions, and these proportions depends on baby's age. Cow's milk is very different in composition from breast milk. Therefore, it can be given undiluted for babies only after 3 months. Such mixtures are used mainly in poor countries. Adapted formulas are much more expensive, but they better meet the needs of babies. The process of changing cow's milk and bringing it closer to breast milk is called adaptation. As you can see, nutritional adaptive formulas are sweet and sour. Sweet formulas are high adapted, less adapted, and partially adapted, and you can see some examples. Sour formulas are mostly contains bifidobacterias. Now to your attention is summary of the milk formulas. Cow's milk protein. These formulas contain cow's milk protein in its complete form. They are usually the first formulas that are tried. The majority of infants will grow well on this type of formula. Partially hydrolyzed protein. These formulas contain proteins that are partially broken down but can still contain larger milk proteins. They are marketed as being easiest to digest. Extensively hydrolyzed protein. These formulas contain proteins that are all broken down into small protein pieces. They are typically fed to infants with cow's milk protein allergy or milk protein-induced proctocolitis. They are also lactose-free. Amino acid. These formulas contain proteins that are broken down into the smallest protein units, known as amino acids. They can be offered into infants with cow's milk protein allergy or milk protein-induced proctocolitis. They are also lactose-free. Soy. These formulas contain soy protein, but unlike cow's milk protein formulas, they are lactose-free. They are useful for some rare metabolic disorders, like as galactosemia, and temporarily after diarrheal illness. Low lactose or lactose-free. Lactose intolerance in infants is rare. Some infants may have transient lactose intolerance following a diarrheal illness. However, most children will not need to switch formulas following a diarrheal illness. Milk-based pre- and prebiotic supplemented, marketed to promote digestive health and support healthy immune. Doctors have to know daily requirements of main nutrients of infants on bottle feeding. You have to know these data by heart. Daily requirements in proteins before and after weaning introduction are the same, and it's 3 to 3.5 gram per kg of body weight. Daily requirement in lipids before 6 months is 6 to 6.5, and after 6 months is 5 to 5.5. Daily requirement in carbohydrates is the same during the first year of life and contains 12 to 14 gram per kg. To calculate the daily amount of food using the volume weight method. But you have to remember that daily food intake during the first year of life can't be more than 1 liter. All nutritional supplements at artificial feeding are given in 6 months, as well as at other types of feeding. All weanings for all types of feeding are introduced at the same age. First weaning is vegetable puree, should be given at 5 months. Second is porridge, it should be given at 6 months. And the last is meat or fish, it should be given at 7 months and combined with vegetable puree. If after a detailed calculation of the baby's menu, it is established that the baby is deficient in certain nutrients, the doctor makes correction. The child is given some additional supplements. For protein deficiency correction, we use cottage cheese. For lipids deficiency correction, we use milk cream or vegetable oil. And for carbs deficiency correction, we use 100% sugar syrup. Physicians should know and explain to parents common mistakes in bottle feeding. This knowledge and prevention work can positively affect the health of babies and the amount of breastfeeding. So, first is frequent change of formula. Next is quick reduce of breast milk intake and increase of formula intake. Stubborn feeding using one formula while child having disorders, diarrhea, allergy, reduced weight gain during 1.5 to 2 weeks. Ignore child's regimen and environmental factors, and ignore child's personal requirements. Dear colleagues, we have completed discussing with you the basic provisions, rules, and features of artificial feeding. Remember the benefits of breastfeeding, and thank you for your attention.